Hello and welcome. My name is Dr. Amanda Heritage, owner and doctor of physical therapy at Breathe Life Physical Therapy and Wellness. I want to invite you to join me and experience an online webinar specifically for postpartum moms. I'm asked a lot, is this normal? Many questions that you have concerning your postpartum body, changes in bladder and bowel function, and even sexual function can be very confusing. There's a lot of information that's missing sometimes once you leave your 6-week post-op or post-baby appointment with the gynecologist. So I put together this program that you can do on your own in the comfort of your home in your yoga pants that's going to answer the questions, is this normal? Most of the time, the answer is yes and no. So for a quick introduction, join me as we go through. So what I want you to learn, let me slide my little face over here. What I want you to learn during our time together during this webinar is truly to understand that there's so much knowledge out there from practitioners in the area to knowledge within your body, but that knowledge is what's going to allow you to become more active, more confident, and more comfortable in your postpartum body. So there's 6 parts to the webinar. One is just an intro. Welcome. Are you ready to find out what's normal? The next is knowledge is power. Basically, all of my clients, and I think all women and men, should know and understand the anatomy of their pelvic floor and core. It's so much more than Kegels and crunches, let me tell you that. Part 3, incontinence. Basically, how do we retrain our bodies to not be peeing? Part 4, postpartum related pain. A lot of women experience low back pain, pelvic girdle pain, that sharp searing pain into your pubic bone called lightning crotch during pregnancy. But then what happens afterwards? Do you know what's normal? We're going to talk about pain as not being normal with any activities of life and with intercourse, and definitely a gynecology exam. Number 5, part 5, one of my favorites. We're going to talk about diastasis recti. There is so much information out there about do crunches, do sit-ups, don't do planks, don't do sit-ups. We're going to talk about what is appropriate for you, and every person is an individual with an individualized program and need. Finally, what's next? How do you know to take care of your postpartum body with this new information? Who's out there that can support you? Is it a physical therapist? Is it your gynecologist? Is it a specialist like a urogynecologist or a urologist that are going to help you navigate this new body? So those are a few things that we're going to talk about. So as we move on, topic specific to is this normal? These are like the big 3, if you will. A lot of the time people ask, is this normal that I'm peeing myself when I'm coughing, laughing, sneezing, picking up the baby? Or is it normal that I'm running to the bathroom and a little bit of pee is running down my leg? I couldn't tell if I was crying out of fear or if my pelvic floor is crying. We're going to talk about those things. Pelvic pain. Pelvic pain is something that I hold near and dear to my heart. It could be any pain that you're experiencing from the belly button to your inner thighs. All between that area is considered pelvic pain. Many women experience pelvic pain returning to being intimate with their partners. That is not okay to have pain for a prolonged period of time after having baby. It's not okay to have pain with a bowel movement, with going to relieve your bladder, and it's not okay that you continue to have pubic pain or back pain that you might have experienced during your pregnancy. These are all things we'll talk about and what tips and tricks you can do to support yourself. And finally, diastasis recti. Again, big buzzword out there. We're going to talk about the gap and tenting that people see. And why is there weakness in the abdominals? Is it just that we need to strengthen and stabilize our core? Or do we have to give respect to things like our hormones and our hydration and so on and so forth that are going to support our bodies and ultimately allow us to move more freely? So why are we doing this? For many people, I am always surprised at how many women come to my office and they have referred themselves to pelvic therapy, whether it's through a mom Facebook group, whether it's through a friend who's been to pelvic therapy or just physical therapy to address their new body and the changes that's going on. But it's funny because there's no research really that's out there that says only so many people go to pelvic therapy after having a baby. In other countries like France, it is a necessity, and it's almost just a given that after you have a baby, you go see a pelvic therapist for 6 to 8 visits before you return to any other activities. So just a little bit of research real quickly. This is specific to having leakage. So only 25% of women actually seek help about leakage. And that is kind of the broad spectrum of women from postpartum to postmenopausal, but only 25% of women actually go to seek treatment of physical therapy. Before that, we're just 35% of us are just changing our activities and saying, I'm just not going to do this exercise. I'm never going to go back to yoga. 70% of us continue to have worry and anxiety and stress and even social distancing because we're afraid that we're going to have leakage when we're laughing or we're exercising or in yoga class. And then 62% of women wait over a year to actually talk to their doctor about it. There's a lot of shame that goes with this. So my goal is to advocate for you and help you to advocate for yourself and other women to know and understand how you can support your body. So there's a balancing act. This is just a quick little intro of what we'll talk about. There's a balancing act of the pelvic floor muscles, just like there's a balancing act of your bicep muscle to extend and to bend your elbow. So when we talk about pelvic floor muscles, we're talking about them just like we would talk about any other muscle. Let's say our bicep, our quad, our calf muscle, and you had an injury there, you'd be fine going and seeing the physical therapist or your chiro, whoever it is. So why aren't we doing the same thing for our pelvic floor muscles? So pelvic floor muscles have this very unique function that they have to be stretched and elongated, but they also need to be able to tense and to create support for your pelvis. So some things that you might notice, if maybe you had a baby and now you have a pelvic prolapse, or now you're leaking with coughing, laughing, sneezing, known as stress incontinence. Or maybe you're on the flip side with a little bit more of muscles that tend to have more tension in them, just like your shoulders that are tense and kind of squeezed to your ears. You may notice that you have stress incontinence just as much as maybe somebody who has very relaxed muscles. That's a fun one to play with, and you'll learn why stress incontinence can be, or leakage can be, from muscles that are actually too tight. But also, are you experiencing pain? Pain with intimacy, pain in your low back, pain in your groin, maybe pain at your 5th mile of running and you're just like, what the heck? Why is this still happening? I've been so strong. Or even constipation. So because our muscles have such a unique function within the body, they need to learn how to be just as strong and supple as any muscle in the body. Okay, so you might be thinking, okay, yeah. I've heard of leakage and I've heard of constipation. And yeah, I had pain with sex when we first started back and it was just awful. I didn't want to continue. But I guarantee there's some other causes or some other things in life that may have also been leading up to some kind of pelvic floor related issue. So any prior pelvic surgery, including hysterectomy, prostate for men, just to keep that in the back of your mind when you're sharing this with your partner or your dad or your brother or your uncle, but also menopause. Estrogen is everything. Maybe you haven't gone through menopause, but at the same time, in our postpartum phase, we're almost in this perimenopausal or menopausal-like state because there's so much less estrogen. Our age is a factor to pelvic floor related issues. And pregnancy. Pregnancy is a huge factor for pelvic floor related issues. About 1 in 3 women will have pelvic floor related issues throughout their entire life. And how many of us have children or go through the process of trying to get pregnant? And we've gone through having labor and delivery trauma of having an episiotomy or prolonged pushing during labor, or had multiples, or even had assistance during labor, like the use of forceps, which is not always great, but obviously baby comes to the world in a healthy manner, but our pelvic floor does suffer the trauma sometimes. Intense physical activity, running around with your children, whether it's your first child or your 5th child, can be intense physical activity. You're lifting, bending, twisting, catching kids, working on all of these things that your pelvic floor and core are constantly trying to manage. Also, factors that increase your intra-abdominal pressure. What does that mean? Anything that creates more force or downward motion in the core, like being overweight, which Hey, when you're pregnant, technically you gain weight in your midsection. Also, chronic straining or constipation. Many women have chronic straining and constipation during pregnancy, and they might have a cough or might have a little bit of reflux that makes them feel like they have to cough. There's other things like, again, I said prolonged pushing during labor. That increases the amount of intra-abdominal pressure. Intra-abdominal pressure in the fastest way is what happens in your core when you cough. So if you clear your throat with me and you feel a little pressure or push out of your belly and everything kind of tenses, that's intra-abdominal pressure. More on that. But also genetic factors. For me personally, I am very hypermobile, meaning I am super flexible and I have to work really hard to keep myself strong and active. But they are also known factors for having a pelvic floor related function or issue later in life. So, what are the actual clues that your body might be giving you to say, hey, look, girl, you need to take care of me. You have something going on with your pelvic floor. If we think back to our balancing act of those pelvic floor muscles, we can kind of put them into two categories just to keep it simple. You're going to think of the pelvic floor muscles as being overactive or a little bit more tense, or underactive and being a little bit more relaxed. So some symptoms may be on both sides of the scale here, which again, you'll learn why in our class, but things like constipation and pelvic pain, the inability to empty your bladder, feeling like you have pain when you pee, or like your stream starts and then doesn't continue, or starts and then you have to pee again when you stand up. Indigestion, any history of low back pain, SI pain, pubic pain, that pubic symphysis pain, like lightning crotch that everybody talks about. That's overactive pelvic floor muscles. There's tricks and tips and ways to be able to treat and care for those muscles. On the other side, there are underactive muscles. A lot of the time, those underactive muscles that are challenging our support structure when we're functioning all day may make us feel like we have pressure in our perineum, may make us feel like we have to pee all the time or pee when we don't want to pee. There might even be a sexual change that you don't quite feel like you have the best orgasm that you had before. Or maybe that there's this sense of, just achiness all over within the pelvis. Again, the pelvic floor needs to be able to be strong but supple to be able to create a healthy and supportive body. So what's next? So what I want you to do, if you decide to sign up for the class or not, I want you to advocate for you. I want you to advocate for your family, your baby or babies, but most of all, you. You live in your body for the rest of your life and you pour out to so many people. So this is a way that you can pour back into you to be refilled. Another thing, if you're experiencing any symptoms at all that I put on that list, reach out to me. I know the right people to refer you to so you can get to the people that will be supportive and be able to intervene as necessary. But also, go call your doctor, ask your doctor. Mom Facebook groups and social media are great, but there are a lot of things that we need from the medical society to help support us. There are many treatment options, as I said, specialists who understand the issue at hand, from someone like me who can as a pelvic therapist, address the musculoskeletal function of our pelvic floor and core, all the way up to somebody who's a surgeon who is able to do a surgery to help your body be restored or regain function, whatever that may look like for you. Everyone is different. So if you decide to sign up for the course, our goals together are going to be to reinstate some knowledge and reconnect with your body's innate ability to support itself. I have some really interesting tips and ways that we can talk to your core without doing a single crunch or a plank. I also want you to be able to retrain your bladder and your bowels so that way you can go back to being active without feeling leaky or stressed that you're going to pee yourself. I want you also to be able to revive your pelvic floor and core so that intimacy, using a tampon, seeing the gynecologist are comfortable, and you don't have to worry about being in pain and how that changes our emotional being and relationship with ourselves and with our partners. And I want you to be able to restore your balance of the core so you can be confident to go throughout your day, not feel like you still look 6 months pregnant after baby, not feel like your back is bothering you all day long if you're sitting in the car, but also to feel comfortable within your own skin, to nurture and to nourish your body as a postpartum body. Is it normal that we're going to go through these things? Yes. But does it have to become your new norm? No. So we're going to put all of this together so you can be active, be confident, and be comfortable so you can ultimately breathe life, breathe your life and your purpose that you've been given.